Well, welcome back to the show today, Dr. Robbins.
Thank you for having me.
It's a pleasure. It's a pleasure. Now, I know some of our viewers got to meet you a while back on the show, but for those of viewers out there who did not get to see that show, remind us a little bit about your background and what have you.
I am born and raised in New York. I did my medical school training at New York University in Manhattan, and followed that with urologic training at Mount Sinai Medical Center, also in Manhattan. After training, I spent 17 years in private practice on Long Island, specifically in the town of Glen Cove, with 2 other doctors.
So you moved south for the weather, right?
I moved south for the weather, and I've been with Novant Health Urology Partners, started in July of 2014, so we're coming on 1 year.
Great, great. Well, you mentioned your practice, Novant Health Urology Partners. Tell me, you have a physician partner, is that correct?
That is correct. Dr. Lydia Labachetta. She's born and raised in coastal North Carolina. She did her training in South Carolina at the Medical University, and she's been with Novant Health almost now 2 years.
Yeah, she's been on our show too, but it's been a little bit, I think a couple months now. So I understand that you've recently added this space here in Southport, and you're here 1 day every 2 weeks?
We're going to see patients in the Southport office every other Tuesday.
Every other Tuesday. And will you be the urologist here in Southport?
Yes.
Okay. So Dr. Lydia will remain in the Bolivia office.
Initially, she's going to stay there, and hopefully we can drag her down to the beach with us.
Well, hopefully you'll be so busy you'll need to both be down here occasionally. So let's talk about services. What types of services will you provide here at the Southport office? I assume it's going to be similar to the Bolivia office.
Initially, we're going to hope to see patients for initial consultative services and all follow-up visits. We are limited initially on some of the procedures that we perform in the office. We don't have all the equipment available to us here at this time.
But that's something we're looking at adding.
So at least for now, for the short term, any procedures that need to be performed will be followed up in the Bolivia office.
I see. I know that you offer a large range of urological services, including surgeries. Tell me more about the types of conditions, though, that you treat.
So urologists in general treat both men and women.
Okay.
Probably we spend maybe 60% of the time treating men and 40% of the time treating women.
Really?
A lot of people think that urologists just treat men, but we treat both. We deal specifically with medical conditions associated with the kidney and the bladder in both men and women. And for men, we treat issues related to the prostate and the genital system.
I would have thought it would have been more even. I'm surprised that it's 40-60. And
we tend to see a lot of women are treated by their obstetrician, gynecologist for some of the conditions, so some of them overlap. And urologists sometimes look at themselves as the primary care doctors for men. Since a lot of men don't like to see their primary care doctors, they end up seeing us instead.
We talked to Dr. Scallion about minimally invasive surgeries. Is this something that you also offer for urologic conditions?
Yes. So urologists treat patients both surgically and medically. We offer surgical procedures for the kidney, for the prostate, also minimally invasive surgery for kidney stones. So in a little bit more detail, for kidney cancer, we offer laparoscopic procedures, both laparoscopic and using the Da Vinci robot. For kidney stones, minimally invasive procedures include lithotripsy, which is a shock wave or a sound wave therapy without doing any surgical intervention. And we also offer laser-based ureteroscopy. For the prostate, we offer Da Vinci robotic prostatectomy, mostly done by Dr. Labachetta, and also surgical procedures for benign prostate diseases, including the green light and photovaporization of the prostate.
Wow. That's a lot of stuff that I don't quite understand. I do understand the robotic piece. I know that we had Dr. Lydia Labachetta on a few months ago, and it was concerning the Da Vinci robot. So I know that that's not available in Southport, so those patients would be done at Brunswick Medical Center, correct?
Correct. At this time, all of the surgical procedures will be done at Brunswick Medical Center. If it requires, if the patient requires a robotic surgery, Dr. Labachetta will be the primary surgeon, and I'll be her assistant.
Great. So it's a team effort there.
It's a team effort. Unfortunately, I was trained too long ago to have enough experience to do this, and at this point we work as a team together, and I will refer all those patients to her, and we'll do it as a team.
Well, that's great information about the Da Vinci robot. And at this time, let's show some videos that we have regarding some of those surgical procedures that you mentioned.
Great.
Well, how about patients who need to see you? Do they, or want to see you, do they need a referral from their primary care, or can they self-refer? How does that work with your practice?
Most of the patients are being referred from their primary care doctors, but patients can self-refer. It all depends on their insurance. And there is no way that I could possibly figure that out. Our office staff is well equipped to deal with it.
That's what I was going to ask.
So we have our front office is Amy and Lena. They can both take care of it. If they call and patients are unsure if they need referrals, they will answer all their questions.
So they'll determine that for them ahead of time, so there are no surprises.
Correct.
So can they also help them with their co-pays, let them know ahead of time what it will cost when they come into the office?
Yeah, it's all known to the patients based on their insurance. And again, if the patient is unsure and they ask our front office, they will be able to tell them, they should be able to inform them of their copay before the visit.
Right. That's always helpful for a patient when they're coming to the office to know that ahead of time, just to be better prepared.
Definitely.
Yeah, I like that too. So if patients have a question or they'd like to schedule an appointment with your office, whether it be in Southport or in Bolivia, which number should they call? Should they call the Southport office or the Bolivia office?
At this time, we're going to make appointments centrally through the Bolivia office. And if they request to be seen in Southport, the appointments will be made through the Bolivia office for here.
Okay, so they just need to specify the office that they want to be seen in.
Correct. And the office is actually offering it based on their address.
Oh, that's great.
So when a patient calls and we see that they're from Southport or closer to here, we're offering it to them without them even asking.
Yeah. Can you provide us with that phone number?
The telephone number is 721-1450.
And
ask for Lena or Amy. They're our front staff office.
Lena or Amy. And that's a 910 area code, correct? Great. Well, thanks so much for being here today. It's been a pleasure. I'm so happy to see that you're in Southport.
Thank you so much.
I think that's going to be a great thing for the folks in Southport, not to have to drive to Bolivia.
It is.
All right. Thanks again for being here.
Thank you.